Hi, I'm Dan Lessard with Health Sciences North. Well, as you can see, we have plenty of winter left around us. And around this time of year, a lot of people get what they call the winter blahs, or there's actually a more technical definition of it, a clinical definition, called Seasonal Affective Disorder. So, what are they, and how do you cope? Well, I brought in some expert help on this one on a very cold winter day. Cindy Gervais is a social worker with the Mood and Anxiety Department of the Mental Health and Addictions Program at Health Sciences North. Cindy, thanks for joining me outdoors to talk about the winter blahs.
My pleasure. This is a perfect day to talk about the winter blahs because it's a very cold day, and when the weather is cold, we're often tempted to stay indoors, not get outside, and when we do that for days on end, that can actually lead to a drop in mood. We can feel more sad and more depressed.
What are some of the symptoms that are common to SAD, or Seasonal Affective Disorder?
We would have lethargy, which is tiredness. We would have a loss of interest in things that would normally give you some zest. We would have difficulty experiencing pleasure. We would find usually a change in appetite, which usually goes in the direction of increased appetite. So lots of wanting to eat the sweets and the carbohydrates, the starches. We could see feelings of hopelessness and worthlessness. There can be thoughts of death and suicide, and negative thoughts, sad mood, isolation, withdrawal from activities that you would enjoy, and then you can also see a decline in functioning in the realms of your work or the social sphere.
This sounds much more severe than just what we call the winter blahs. Is the symptomology much different between the two?
Well, it's a matter of degree. So what we call the winter blahs is actually what we would call clinically subsyndromal seasonal affective disorder. So
seasonal affective disorder light, really.
Yeah, light. Yeah. So you might have some of the symptoms, but it's not to the degree where it would be a clinical diagnosis.
We've talked about the problem. Let's talk a little bit about the solutions, and we'll begin with seasonal affective disorder, because that is a clinical diagnosis which requires, I guess in some cases, clinical intervention. Just describe that.
So if we want to look at treatment for seasonal affective disorder, we have cognitive behavioral therapy, medication, and light therapy. So all three are methods that are effective, and there's been studies that have proven that they are effective.
For people who just have the winter blahs, they haven't regressed to the point of SAD, what are some of the things that they can do?
Yeah, that's a really good question. So I would recommend that you continue to schedule pleasurable events. You continue to do things that you find enjoyable. Continue to stay in touch with positive people, and continue to think positive thoughts and be hopeful. Exercise is really good, and get out into the bright outdoors, preferably in the morning. So when people are getting their light therapy, it's usually best to do a morning dose of light therapy. So if you want to incorporate some of that, put on some gloves and a hat and get out, go skating, go skiing, get outdoors.
And if you can't, for whatever reason, just open the curtains, get some more light into your environment?
That's perfect, Dan. That's exactly it. Let some natural light into your environment.
Well, thank you for shedding some light on seasonal affective disorder and the winter blahs. Cindy Gervais, thanks so much.
You're welcome. My pleasure.
I'm Dan Lessard. You're watching HSN.